we saw the impending doom of doctors being affected. The last thing we wanted, Kevin, was doctors treating their own colleagues in ITU. That's not what we wanted to see. So every day we saw how healthcare workers were being affected, especially those from ethnic minority groups, South Asian, Black ethnic minority groups. And we saw that healthcare workers were dying. And it was very simple. There just wasn't enough protection. And the government failed to protect us. And it was this systemic negligence that allowed so many healthcare workers to die across the country. And it was a death of nurse Mary Ajapong in Luton Hospital. She was a pregnant nurse. She was 8 months pregnant and she passed away, leaving her newborn baby behind. I was also pregnant at the time, and that really hit home for me. Kevin, I couldn't just watch her family suffer. She left her newborn baby behind, her 2-year-old son behind, and all of this could have been completely avoided if the government had took action early on. So we launched a legal challenge with the government, and it was a case of just protecting healthcare workers. We wanted a change in policies. We wanted the government to be held accountable to say, okay, we've done something wrong. Let's try and fix it now. Let's try to prevent more deaths. But during the time that we sent the letter, to this day, we've had 500 healthcare workers die. And this is because they failed to respond to our letter. And our last option was to take the government to the High Court. So the time frame should be in the next 4 to 5 weeks. We have asked for an expedited judicial review because we understand the sense of urgency behind this. The virus is still here, is still within the hospitals. However, the government have done a very good job to distract us by easing lockdown and by avoiding these daily press briefings. So we actually we're not actually aware as public members of the public, we are not being tracked on how many people have died and how many healthcare workers are being affected. But I know that lots of healthcare workers are still in the same situation because I receive messages from families saying, I've lost my father, he was a doctor. I've lost my mother, she was a nurse. So I know what's really happening. And it's a big shame that the government is hiding this from the public. That if policies are changed, if the government acts, if there is a second wave in this country, we can prevent what just happened a few months ago. We can prevent all of these deaths, and that's all we want.